You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. And according to my first guest, she says nobody should be wearing a loose-fitting denture. With us, we have an expert on this topic. She is Minnesota's go-to implant dentist, Dr. Cheryl Lindgren. Dr. Lindgren, welcome to the program.
Thank you. It's a pleasure to be here.
Now, I have lots of questions, but before we start, for people that don't know your center, because I know you do just about everything right there, a team of dentists, but who's the typical dental implant patient?
I guess we don't have a typical dental implant patient, but generally they're falling into two categories. First, we'll have the group of people that still have teeth. They've maybe been seeing a dentist their whole life, but now they're hitting a point where they have bleeding gums. They may have spaces between their teeth. They've maybe started to lose some teeth, and there's infection going on. They've gone to other dentists and been told that they have to head for a denture at this point.
Okay.
And they come to us to see if there's any other options.
Because they don't want a denture.
They don't want a denture.
Nobody wants a denture.
Exactly. And so we'd like to talk with them about being able to give them a new set of teeth that are supported by dental implants. The second group of people that come in are the current denture wearers already. And they've maybe been wearing a denture almost their whole life, or they're new to a denture. But generally, none of these people enjoy having dentures.
Okay.
And they're looking for an alternative to wearing the dentures at this point. So for those people, we can give them a brand new set of teeth, upper and lower, supported by dental implants.
Now, now I know you have offices that are close together in Minnesota and Wisconsin. Is that correct?
Yes, that's correct.
And people travel great distances to see you. Is that right?
Yes, they do.
Like, what areas do you serve mostly?
We'll serve the surrounding communities near the St. Paul suburbs of Minnesota within probably a 40-mile radius, and then also we're in Hudson, Wisconsin, so they kind of overlap their areas.
How old can you be? Like, what's the highest older range to get this done?
Well, I guess if there really isn't an age range. If they're healthy enough to get to our office, they're generally healthy enough for us to give them some implants.
It's like an 80-year-old can do this?
Yes. So the oldest patient that I've done this on was 85 years old.
Really?
And she couldn't have been happier.
Why would an 85-year-old want to do this?
Well, at 85, she's enjoying life. She's in the prime of her life right now. She's traveling with her children, her daughters. They're going places. She wants to be able to eat, and she's very social. She smiles a lot, and it was very important to her just to be able to have a set of teeth that she felt confident with when she was eating.
So they're not more likely, these dental implants, to fall out if you're 80 years old?
No, absolutely not.
Okay. So in your area, I mean, are there really that many people that are either headed to dentures or currently wearing a denture? I mean, is it a big problem there?
You know, surprisingly, it is. Probably every week, for sure, I have patients coming in that are headed to dentures, or they'd say to me, you know, my grandparents wear dentures, my parents have dentures, and I know that I'm just headed to dentures. So I still am having people come in that I'm treatment planning dentures because that's what they're asking for.
Are there tens of thousands of people, like within an hour of your practice, tens of thousands of people with an upper or lower denture?
Yes. The latest, I was doing some research on this, and the latest numbers that I found, they said just under 40 million people in the U.S. alone are with an upper or lower denture or partials. And I bet within 100 miles radius of my practices, we could fill half of U.S. Bank Stadium with people that are missing 9 or more teeth. Yes.
Well, then if it's so good, why aren't they all doing it? Like, what's your take on it? Why they're not coming in to get new teeth supported by implants?
Well, I think there's probably 4 or 5 reasons that this is the case. Number one, if somebody's already wearing a denture, they're generally not coming to the dentist any longer. So I may see them after they've had a denture for 20 years that they're loose or not fitting right, or they have some sore spots. Because what happens, they start to lose bone that they had when they initially got the dentures. The dentures aren't getting any bigger, but their mouth is just shrinking. You know, so then we're able to talk about they'd just be in for a reline or something like that. I guess the second.
So they don't know their options.
They don't know their options at this point. So we're able to talk over that with them. The second thing is a lot of these people have spent so much time in their previous life of trying to care for their teeth. Maybe they had fillings that started young. They end up with root canals. They end up with cracked teeth, crowns, and they have spent so much money and time at the dental office that finally when they hit that day of I'm going to get a denture, they're just happy to be done with putting all their money and
the
time.
last thing they want to do is come in to see you.
Exactly.
Do you still hear that, by the way? Like, no offense, doctor, but I don't like the dentist?
Yes, we'll hear that all the time.
Really?
People would rather deliver babies, go to the doctor. Like, they do not enjoy coming to the dental office until they come to our office and they get a different experience.
You know, and we talked in the green room, and you said if they knew how good, we had a discussion about this, that if they knew how good it was, there's not even enough dentists to handle all the denture wearers that would benefit from this procedure.
Absolutely.
And you believe that?
I absolutely believe that. I don't think we could, all of the dentists, if you would take those tens of thousands of millions of people that are missing teeth or denture wearers, we'd be so busy we'd never be able to help them all.
So at the top of the show, I said, according to my first guest, nobody should be wearing a loose-fitting denture, no more dentures. So do you think maybe 20, 40 years from now, the future of dentistry, dentures as we know them today, won't exist? They'll all be attached to something?
I believe so, and I sure hope so. I really am passionate about people being able to have this option, to have fixed teeth in their mouth and not worry about the insecure feeling of their teeth popping out or not being able to chew like they want to, salads and nuts and things like that. So I sure hope so. I think we're headed that way.
And do you see that all the time? Like, for example, people come in one way, maybe shy, reserved, maybe you get a wrong read on them, and then you fix their teeth and they're like different?
Yeah, I see that all the time. I just had a patient come in not long ago, and his only complaint was, I'm missing some teeth in the back and I just want to be able to chew better. And after we did a consultation, kind of talked through his options and decided to really fix up a lot of things, everything with a combination of implants and crowns and bridges, he became a different person, and he didn't even realize that was going to be the case. But he comes in the office now, he's smiling all the time. He tells me, I never knew that I would smile so much. He's just so happy about it. So you asked about the typical person that comes into our office. Another group that I'd like to talk about are the younger generation, where maybe they've had to be on antibiotics like I did initially, or maybe they've had battled with some infections.
Like
or
in their
some
20s?
Yes.
Kind of thing? Okay.
Yes. They've battled with health problems, infections, and things like that. And so I know now at this point that this could be life-changing for these people if we can see them at that younger age and kind of get them onto a path of a healthier and more confident look of smile for them. For example, I had this one mother bring in her early 20-year-old son, and he really needed to get his teeth fixed at this point. And we went over options, and she was dead set, I want to do this for him, I'm going to pay for this. And we did a full case of crowns, veneers. So Randy, as parents don't understand, but this can change this person's life. As I found out for myself, he's going to be more confident. He's going to smile more. He's going to be looking for somebody to date. He's going to be
taking selfies?
Yeah, taking selfies. He'll be on Instagram. He'll be, heading off to probably a different career path even. It is life-changing for these people.
Okay, now, so moving back to the person, let's say that they're of the two categories. They have really bad teeth and gums, and they're worried they're going to end up in a denture. Maybe they were told at another office, your only option is a denture, or the actual denture wear. So what are their options in your practice when it comes to dental implants?
So when we see people come in for dental implants as a consult, we always go through the options with them. The first option is we can place 2 implants down on the lower jaw, we'll talk about, and then they can have a denture made that snaps in, snaps out.
Okay.
The problem with those is that it's still tissue supported in the back, and that denture moves around if they eat.
Okay.
And they're able to take it out, clean it, and it's, it stays in for the most part. They can chew with it. So they have that option. The next option, we can maybe add 2 more implants. So we can go with 4 implants. So we can get the back supported a little bit better.
So they just snap in,
They snap in, snap out.
Okay.
Yes. There's a little more maintenance to those, in that we still have to see them maybe twice or 3 times a year to change out the little snap-in
Can
parts.
they eat with them pretty well?
They can. They can eat with them pretty well, yes. And then on the upper, we can still do the same thing. We can put 4 or 5 implants on the upper, snap in, snap out, but they still generally have a palate that covers taste buds and things like that on top. then the option that most people are interested in is when we can do a full new set of teeth, upper and lower, that are in their jaw with implants.
Like how many implants typically?
So on the lower, we can do 4 or 5 implants, and on the upper, we can do probably 6 implants, and they'll have a full set of teeth in there. Chew anything that they could chew before with their teeth when they were healthy, before they had gotten broken down to a certain point.
What do they like more, the way it looks or what they could eat?
Well, that's so dependent on the patient, because you'll have people come in that'll say, like the previous patient that I talked about, he was just interested in being able to chew better. I just want to be able to chew. But then you fix him, you give him these teeth, and he's like, oh my goodness, it's opened up a whole new world. Or you have people that want to come in and just say, I want this to look better. I just want to look good. My grandkids are asking me about my teeth all the time. Why do they come out? Things like that. They just want to look better. And in doing it, they end up restoring their bite. They're able to chew corn on the cob, things like that again, that they never were able to enjoy for so many years. So as an example of one of the patients that comes in just wanting to have a better bite, being able to chew better, things like that, my dad was a perfect example. I didn't ever know it, but he was missing almost all of his back teeth at one point, and that was really important to him to be able to chew again. And so we did all kinds of dental work on him, and he, again, the same thing, he became a different person because it changed his look. He went on to different schooling. Like, he was just over the top about that he had been able to have his teeth all fixed like that.
Now, I think we've talked about this, but if you're missing teeth in the back, why is that such a problem other than maybe the obvious for chewing? But why should somebody do something about it?
So if you're missing back teeth and you're chewing on your front teeth, they start to flare out and they'll get spaces between them. They're not made to do that chewing like the back molars are. And so pretty soon somebody's face gets shorter, their teeth are flared out.
So you end up losing your teeth?
Yes, you end up losing them then because the bone isn't supporting them any longer, and it's a problem.
So is that kind of a straightforward procedure? Somebody's missing back teeth, put in some, I'm making it sound simple, but you put in some implants and they're chewing again. And they're back, and it's going to prevent them from losing more teeth in the future?
Yes, so there are situations like that where if we like to save teeth, don't get me wrong. If we can save teeth, that is the superior, but also you hit a point where some teeth just we're not going to be able to keep them in there. And if you're looking 3-5 years down the road, I want to be able to share that with people. What are our options here? And give everybody the best option for them at that point.
Okay. Now, correct me if I'm wrong on this when it comes to dental implants. How dental implants are typically done is you go to one doctor's office that does the surgery, where they put the implants in, and then another office where they put the teeth on top and then maintain them elsewhere. At your office, you do all 3 parts right there. Is that correct?
That's correct.
Is that why you do it so quickly?
Yeah, we can do it quickly. We can do it more cost effectively. It used to be like that where you had to go out to different offices, and I think keeping it all in-house really benefits the patient because we're able to do it. And the way that it's done now, all digital, guided, this new XD system, we can place the implant so that it's perfect for us to be able to put new teeth in there and not have to have the patient shuffling around to different places.
Okay, again, I don't want to put words in your mouth, but the way I understand it, based on our conversation, is it can take up to 2 years at some places to get to those where you could get upper and lower teeth that are supported by implants. At your office, you could do it in some cases in just 4 visits.
Yes.
3 or 4 visits.
Yes, absolutely. I'll see them a first visit. I'll do a computerized CT scan, look at what our options are. We can have a conversation about which route is best for them. And by the next appointment, we could be placing the implants and they could be leaving with a full set of upper and lower teeth.
That don't come out.
That don't come out. They may be initially like a temporary set, but they still are, they don't come out.
They don't come out.
No.
So how soon can they eat?
So they can eat immediately afterwards. They maybe start with a softer diet initially, but let me tell you, if somebody has bad teeth, they're not used to being able to eat the things that, like pizza, salads, nuts, things like that. And within a short time, they're going to be able to eat those foods with their
So people that, let's say, have dentures or bad teeth, they tell you. So they can't eat like pizza, like chewy things?
Exactly.
Or almonds or whatever?
Right. They'll say they miss having those things. Or they miss, if they have a denture, they miss having a nice glass of wine or something that
Why
they
is
can
that?
taste.
Oh, because the palate
is
okay,
covering all the
interesting.
taste buds. So they have been missing all of those things.
I know a couple of denture wearers. They never complain about anything. Are you saying there's no such thing as a happy denture wearer?
Well, no, but they're not going to tell you that they're unhappy with their dentures.
Okay, that's fair.
But they come in to see us, and we hear about all of the complaints that they have. Especially a lot of longtime denture wearers are at a point where they're having to wear adhesive in their denture, and that is a huge complaint for people. It's sticky, it's messy, helps keep their teeth in, but it's hard to clean out.
So a denture wearer, on the day of the procedure, literally can walk in with no teeth, walk out that same day with upper and lower teeth that don't come out on the day of the procedure.
Yes.
Is that correct?
It happens all the time.
Okay.
Yes.
So is this one of those word of mouth things where they tell their friends?
Yes, they will definitely tell their friends, and I will get the internal part of that where somebody goes, they tell their brother-in-law. I've seen the brother-in-laws, the friends, the siblings, like the whole family. They'll end up sending in people because it's worked so well for them.
So this is the newest, hottest thing in dentistry, like giving people their teeth back with dental implants.
Yes,
is that right?
I believe so. It's been going on for a while, but it's getting to where the time frame is shorter and shorter. We're able to get them in permanent teeth in a shorter time.
And you travel around the country to learn this. Is that right?
Yes, I've traveled to all different countries, done all of
Other
the training.
countries?
Yes.
Why another country to learn to do this?
Well, some of the key thought leaders are in other countries where they're staying ahead of the curve, and we're just learning the new process for things.
Now you're big on technology.
Yes.
You told me that on the phone. What does that mean to the patient? What does that mean to the patient?
Everything is easier for the patient, faster for the patient, more accurate for the patient. It's all about their experience being better.
Now, that impression stuff, the gooey stuff, I guess you have cameras now that go in the mouth to eliminate that in many cases.
Yes.
Is that not true?
People hate this part about the dentist, and I'll hear it all the time. Do I have to have that gooey stuff, take the impression in my mouth?
Yeah.
And we don't have to do that any longer. Everything is digital. We scan it. We take a camera, we scan their whole mouth. They can see it all right up on the screen as we're doing it.
So no more of that stuff?
No
the
more
impression
of that
material?
Stuff. No more of that stuff. It's all digital impressions.
Is that are they always surprised about this?
Yes. The patients, and especially if they haven't been into the dental office in so many years because they've been wearing a denture or they haven't been coming in. This is all new technology that just blows them away. Yeah.
Now people accuse dentists of recommending things that they don't need. And we're having a discussion in the green room where some people have determined, I want to pull out all my teeth and get implants, and sometimes you have to talk people out of that.
Right. As I stated earlier, we want to save teeth. Like that's what we love to do, is save teeth, restore teeth. But there are times when, talking with the patient, we go over what are their outcomes? What are they looking for? What are their goals with their teeth? What are their goals with their life? Things like that. And we can then tailor and create a treatment plan for them.
So you do like veneers, root canals? You do root canals?
Yes.
Right there.
I have a team of doctors, and everybody kind of has a different specialty area that they enjoy and work in. And so yes, if we can save teeth, absolutely.
So on the implant part of the practice, are most of the patients going to be able to see you at least once?
Yes, they will definitely see me for sure for the consultation and the workup of the plan with them, and then oftentimes for the surgery too. I have another dentist that also does the implant surgeries too.
Now what about dental insurance? I mean, even the best dental insurance covers very little. Medicare, Medicaid doesn't really cover this at all. But you say people are financing this.
Yes.
Is that right?
People generally can find a way to finance it, different options. We offer a lot of different options in our office too, because I'm passionate about people being able to have this option if they want it. So I have tried to figure out different plans that we can come up with that allows them to go this route.
Now, I know you flew in, right? And you're flying here. You know you're going to be interviewed. What did you want to make sure people knew about your practice and about giving them new teeth with dental implants?
I just wanted to make sure that people understand, number one, I've been there in a situation of not happy with my teeth.
Okay.
And I understand about being in the dental chair, what that's like, and trying to make them comfortable. And also, I've had enough patients now go through this process of the implants that I know they end up taking a step that changes their life for the better.
That's nice.
They're able to chew, they're more confident. It's something I want them to do.
But what if you have bad gums? If you have really bad gums, can you still get dental implants?
Yeah, so if you have bad gums, on the day of the procedure when we take out teeth, we clean all of that infection out. Everything is cleaned up, the gums are cleaned up, and then we put the dental implants in, and they don't have that infection any longer.
And the gum gets better.
The gums get better.
So it's an
healthier.
infection.
Yes, they have an infection going on. Bleeding gums, things like that, it's an infection going on. So we can clean that up. And putting the implants in, it helps them to keep the bone that they have at that point. So they're not going to then 10 years down the road, 20 years down the road, they will have that same bone. It will not go away with the implants in there. So the most expensive thing about this procedure, Randy, is people are spending so much when they go out to eat now, or they go traveling. Like, they're just enjoying life at this point. So it's so fun to be able to do that for people, that they're experiencing it in a different way now. And if you're lucky enough to travel the world, people are wanting to be able to go out to eat, enjoy those experiences, socialize with people, not worry about their teeth or bad breath or bleeding gums, things like that. So I think it's very important, even later in life, that they're able to have access to this care.
Now, you say that people hold on to their teeth too long, that most of your patients that come in to do this, they've hated their smile for 20, 30 years. Is that
yes,
accurate?
Absolutely. And then sometimes they'll go through this back and forth of, well, I'm too old. I don't, I've had this smile for this long. I don't need to do this now. And you have to have a lot of conversation with them that you should be able to do this for yourself. Like, you don't understand that this is going to be something very important for you. And so after some talk around it, sometimes we'll get them to come around.
What's it like for them to see their new teeth in the mirror for the first time?
Well, when we show people their new teeth after the day of the procedure, and all of our patients for the most part are sedated when they come in. So they're sedated, but they're awake at the end, and we give them a mirror. First thing to show, several of them start crying right off the bat. They're just like, I am so happy with these teeth. And that's just the outward, the aesthetics part of it that's exciting for them. That's not even saying anything yet about inwardly how they feel now with having this smile and this ability to chew again.
Now, when you're with a patient and they're telling you their sad story of their dental problems in the past, and it's been determined they're going to move forward with this, getting new teeth supported by implants, do you ever think, like, they don't know how good this is going to be? Yes,
absolutely. I'll get so excited about it for them because I know, and I've just seen what happens. I had a patient, a quick story. I had a patient that he was a big, tough guy, and his teeth were broken down, and he went the route of having everything, new upper and lower teeth fixed in. And he became this different person, and he was so excited, and his wife actually was getting upset because he was being hit on all the time by all the other women when he'd go out. That's and things nice. Like that. And so I know that they don't even realize that this is something that's in their future yet, and it just gets me so excited.
So they returned back to who they used to be? They're probably that...
Yes.
Is that right? Because now
now just over time, it's just they've gotten a little less confident, a little less... sure about themselves, or they're not smiling like they used to, they're not comfortable chewing like they used to. So yes, I get super excited about it.
You say people with bad teeth say they feel judged by other people. Can you expand on that?
Yeah, absolutely. People will come in and tell me that they feel, number one thing, bad breath. Let's say, for example, their teeth they have gum disease, they have bad breath, and they think, other people think they're not brushing their teeth, or they're maybe a lower economic status, and I'll hear that all the time. Or they're feeling like they can't get the job that they're going for the interview for because their teeth are not looking. Yes, they'll say this. Right? Their teeth are not looking like they take care of them.
And we talked about this, like in the movies, whenever they're trying to portray somebody that's poor, they give them bad teeth.
They give them bad teeth, or make them look all discolored, or
Like at even Halloween stores. Right?
Yeah, that's the thing they sell. Everybody sells the
bad teeth.
The bad teeth, yeah. The pointed teeth or missing teeth, things like that. For
So
sure.
the opposite's true. People are judged also with good teeth.
Yes,
Like maybe they're more
opposite.
educated, have more money.
Do
you find that as well?
They're happier. They're in a better mood. They're the one that's going to get the better job. Everything like that is true about people that smile more.
So you think the smile's like probably the most important thing because you're a dentist.
Well, I'm sure. I mean, dentists do think the smile is the most important thing, but it's not just because I'm a dentist. I believe that our culture believes that also. A smile means so many things to people. When you see a smile, it means that you're in an upbeat mood. You're healthy. We take for example, somebody going for a job interview. You have two people, and you get the person that comes in and is smiling, and they're confident with their smile, and they're happy with how they look. Or you get the person that's kind of covering their mouth, doesn't want to smile. You're gonna absolutely go towards hiring the person that has the smile and is,
or at least more charisma, right?
Yeah, more charisma. A smile makes you seem like you have more charisma, or maybe you even feel like you have more charisma just because you're able to smile and feel confident about your teeth.
I think you told me they come in, like 6 months later, they're dressing differently,
Yes.
acting differently.
The men have shaved a mustache off or a beard off because now they want their teeth to show.
Okay.
It's just it does absolutely make a difference for people in their mood. And we know too, a smile is healthy. It boosts your immune system. It takes your blood sugars down, your blood pressure down. It elevates your mood. It's just, I think a smile is really important.
So people with bad teeth, they just can't eat like fiber, like broccoli or salads or things like that.
Absolutely,
Is that right?
yes. They can't eat salads. They'll say which is funny to hear, but that's a main complaint of denture wearers is that they can't eat things like a salad or the healthy foods like that. So that when we give them new teeth, changes their health even because they're able to digest food better, chew it better. It makes a difference.
Now because it seems so painful, but I guess they're numbed up. And you do IV sedation?
Yes, they're numbed up, and actually I'll generally bring in a team of like nurse anesthetists so that I don't have to worry about the sedation process. They're monitoring their blood pressure, their heart rate, everything. They're taking care of that. And I'm focusing on the actual procedure itself that day. So when they're finished, they have no memory of what happened.
Is that right? Okay.
They've been numbed up. They generally just get over-the-counter pain medications. Maybe antibiotic, but yeah, and I'll see them back in about 2 weeks, and they'll say, I hardly had any discomfort.
Is it usually easier than they thought it was going to be?
Almost always.
We're out of time. So final message to the two groups of patients. One group with really, really bad teeth and gums, and they feel like they're going to end up in a denture, but they don't want one. And then the denture wearers. They've heard what you have to say, but maybe they're still skeptical or afraid. What do you say to them?
Well, I can totally understand that, but I would say I invite them to come into our office, free consultation. Let's just meet one another, see if you're comfortable talking with me, and I'll go over options for you.
And you'll go over the payment plans and things like that.
Go over everything, and then they can have time to, bring in their spouse with them or whomever they'd want. Have time to go discuss it, and then let's talk about what you can do.
Okay, good. And do they go to the website to make the appointment, or they can just call directly? What do you prefer?
They can do either. They can go to the website, but there'll be a phone number so they can call, and then they can speak and get more information with somebody on the other line too.
Okay, good. I want to thank you for coming on the show. Good stuff.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.